How to set up the Sleeq Max to the correct circumference. Out of the packet, each Sleeq Max is set up as a size 1. To properly size, take a waist circumference from your patient and refer to the size guide. We size this patient up as a size 3. To increase the belt size, lift up the Comfo pull tabs and fasten posteriorly. Unfasten the crescent connectors and pull the wing out until you reach the correct sizing arc. In this case, we are aligning with sizing arc 3. You can see indicated size 1, 2, 3 and 4. Once aligned with the right size arc, refasten the crescent connector. Do this on the left and the right wing so they match. Next, we attach the posterior wing shells. For size 1 to 3, align the central arc on the posterior wing shell with the patient's sizing arc on the LSO section. Secure the Velcro tab internally. Do this on the left and the right. For size 4 patients, use the posterior arc on the posterior wing shell, and this will allow more shell to be around the patient, giving improved lateral control with larger abdominal circumferences. Finally, we attach the lateral support panels on the left and the right. To adjust the sternal bar, open the clip anteriorly and increase the sternal bar height to the desired length using the telescopic adjustment. Then close the clip to lock in place. Standard practice is to have the sternal bar 1 to 2 inches below the sternal notch when standing and half an inch below the sternal notch when seated or supine. If there's a gap between the sternal pad and the chest, or there's too much pressure on the chest, the sternal bar can be bent to achieve proper positioning with bending irons or over the edge of a table. Please note, do not bend the sternal bar in the toothed area, always bend above. Due to the limitations of this video, we have recorded the fitting of the TLSO with the patient sitting. However, in the majority of situations, this brace will be fitted lying in bed. You need 2 practitioners to log roll the patient and first of all get the belt section in place. To do this, we recommend log rolling towards an assisting practitioner, sliding the belt underneath the patient to midway, applying some downward force on the brace so that it does not become uncentralised, and having the patient roll back onto the brace. Then we recommend placing the anterior section as shown here, and the brace fastens to the anterior sternal section from left and then to right to fasten securely. We then recommend fastening up the shoulder straps if you're using over the shoulder straps for lumbar fractures, or underarm a strap attachment setup if you're using it for higher thoracic fractures. Once the shoulder straps are firmly secured, they can be tucked into position neatly to keep the straps and the excess length out of the way of the patient, which leads the patient to have to increase the inter-abdominal pressure via the Comfo pull tabs to a level where it's comfortably firm and the brace is providing good flexion extension control. Ensure when doing shoulder straps that these are not over tightened so as to pull the brace up on the patient. For improved flexion, extension and lateral flexion control, we recommend setting up the Sleeq Max TLSO as an underarm configuration for higher thoracic fractures. To do this, simply unvelcro the strap attachment point posteriorly and line this up with the line of the axillas and refasten securely. Rotate the clip attachment points so they are facing horizontally. Reclip the straps underneath the axilla line, ensuring the pads are centrally located and comfortable, and tighten to ensure there is good flexion and extension control.